Welcome back. You're still watching The Globe. Fighting gender-based violence has taken centre stage at the official launch of the new traditional men's parliament in Cape Town. The institution aims to address various social ills and HIV and AIDS. The parliament will constitute more than 800 members, among them stakeholders from different sectors, such as the South African Parliament, the National House of Traditional Leaders, Khoisan leaders, and the South African National AIDS Council. In 2018, a national men's parliament was established, mainly to respond to the prevalence of gender-based violence. Now there'll be other official launches throughout the 9 provincial legislatures. Well, joining us now via Zoom is Dr. Matome Kganakga, who's the Deputy Chair of SANAC, Men's Sector, to tell us a little bit more about the launch of Men's Parliament. Thanks very much indeed for joining us and welcome to the programme.
Thank you, Peter, and the viewers of SABC.
All right, let's perhaps begin with the basics to help people understand the concept of Men's Parliament. What does it mean and how do you come together?
Men's Parliament is a concept that is familiar to all of us as Africans. I think since time immemorial, in every language, whether it's Khoro, Lekgotla, Isibaya Samadoda, Ibuhlanti, it's a place where we meet as men to engage on issues that require our response to matters that are affecting society.
All right. So in the modern incarnation, how do you do that?
So we established the Men's Parliament in 2018, we actually had a consultation before then where we called on to the current president at Constitution Hill because we were concerned around our ability to respond to the issues of health, issues of socioeconomic and broader developmental issues. And one of the areas we identified was that we were working in silos, incoherent, and our programs were not really cohesive, be it in civil society, government, private or developmental partners. So under the Takwani Reme, which is a vendor expression for Let's Stand Together, we agreed that we need to institutionalize a responsiveness movement. And so we looked to the sectoral parliaments, which were established as far back as 2004. I think we were familiar with the Women's Parliament, Youth Parliament, Children's Parliament. So we looked to that because Parliament carried the legitimacy, especially for public participation and accountability.
How does it translate into action? Because people can sit, they can discuss, they can go onto social media and say this is what we must do, but how do you translate that into tangible differences, particularly when we look at things like gender-based violence and HIV and AIDS?
Yeah, so the issues of HIV and AIDS and TB and gender-based violence and broader violence in society, those are systemic issues. They're not arbitrary, they're not sporadic, and so they certainly don't require reactionary response. We need to respond to systematic problems with systematic solutions. So, the Men's Parliaments, for instance, once every 2 years we meet at the National Assembly where we establish a program of action with targets and taking on the current existing national strategic plan, be it on gender-based violence and femicide or HIV, but hold ourselves accountable in terms of what is our contribution to those response of the various national strategic plans. And we then cascade that to the annual provincial sittings and biannual district and quarterly local municipality sittings. And it's in those places where we ensure that we leave no one behind. So Parliament, again, to emphasize the importance of public participation, because as I expressed that under the Takwani Remit, it's not just about responding to the issue, but ensuring that we respond collectively and we leave nobody behind. But in the process, we account in terms of the progress that we have made, and where there are issues, then we're able to self-correct, or where there's progress that has been made, to amplify those particular programs. So it's really about ensuring that our response is coherent, it's cohesive, but most importantly, as men, we are holding each other accountable.
So you have people in Parliament who are members of this Men's Parliament, and I wonder, does this translate into them becoming advocates of what's decided in the Men's Parliament being taken to the National Assembly, for example?
Absolutely. So the Men's Parliament is really a bottom-up approach. It's issues that are actually just discussed. For instance, we're launching the traditional men's parliament today. So it's about men meeting in those traditional councils, in their communities and establishing, their own plans of actions within the settings in terms of the response to the local context issues. And those issues are then cascaded to the higher, local and districts, where there is a re-emphasis and reinforcement of ensuring that, we are tracking our response and looking at the milestones that we are making or not, and getting an appropriate response. Of course, the members who sit in the parliaments also sit as representatives as well as of communities in terms of, particularly at the higher level, bringing those issues that have been discussed on the ground, so that not only do we look at it from a silos in terms of a community response, but there is a shared process between communities, between local municipalities, between districts, where there can be shared lessons on how to respond to the issues that are affecting the particular communities.
You've said that one of the things that is important is holding each other to account and being accountable to each other. Show us how that has worked.
So it's about tracking, the data. For instance, if you look at, I'll make an example with HIV. We've got this UN AIDS 90-90-90 target, where 90% of people who are living in HIV, must know their status, and of those who know their status, 90% must be on treatment, and then 90% of those must be taking their treatment consistently, so that they are virally suppressed. Now, if you look at that data, generally, you would, get the impression that we are progressing quite well, because we are almost reaching that target, which has been actually increased to 95. But if you aggregate it and break it down to gender, then you realize that as men, we are contributing, far less, certainly than, a woman. The same applies for COVID. If you look at the data overall in terms of who's going for vaccination, it may look, somewhat progressive, but if you aggregate it to data, you'll see that men are lagging behind. So it is that data-driven response that is absolutely important. You cannot separate meaningful response to a program without adequately accounting and breaking it down to the data, but not only breaking it down for the data's sake, but developing targets so that we are driven in terms of responding to the issues that affect us. We often talk about, 8 women are killed every day in South Africa. There's 57 murders a day. Now, at community level, those are very difficult to aggregate and appreciate. But when you break it down to the unit level, to say at SABC, a colleague is murdered every, 3 weeks. You are now able to really zoom in to say, what do we need to do to at least extend it to 4 weeks, and then to 6 months, and then to 12, and then to eliminate it months in a year. So you're able to really measure your milestone, but also see what interventions were made to improve the response.
Gender-based violence, sadly, it's mostly men. And bringing and holding men to account means holding men who are doing it to account. Is there an appetite for that? Because it's one thing to say it and another to actually do it.
So that's why we are institutionalizing this responsive men's movement. We're not leaving it to chance, Peter. We are not interested in being reactionary to issues, because that's an obvious response, to respond when there's spilled blood. That's why we're ensuring that we're meeting not only at national level once every 2 years, but in communities, structuring it that we're meeting on a scheduled basis, but then taking it from communities and ensuring that quarterly in local municipalities we're meeting, also in districts twice a year, and in province annually. So it's a structured response. Where we then undergo the process that I alluded to of ensuring that we are accounting on all these various levels. So it's not only just accounting at one level, there's multitudes where we're able to really re-emphasize or review our response as society. So the principle of us, society, organizing, it's actually at the heart of an adequate response. And the issues of GBV themselves, they are a reflection of a disorganized society. A society those who are familiar with the concept of neighborhood watches and these what we consider safe communities, it's simply because those communities are organized. It's not some miraculous or phenomena. It's just simply that particular being organized where when an issue emerges, the system kicks in a responsive manner, but it's able to also preempt because it's a system that needs to engage with the issue. So we are not confused about that. We are well aware that the issues of gender-based violence cannot be de-linked, and earlier that's why I raised the issue of responding systematically to systematic challenges confronting our communities.
Some might say, why the need for a men's parliament? Because men are pretty much in charge of most of the institutions that should be dealing with a lot of the issues that you're talking about.
So this is a gender discussion. There is a discussion of being in an office, and of course you can still genderize the office space, but when somebody sits as a mayor, they're not sitting as a male mayor, they're sitting as a mayor, occupying an office. Here we are zooming into the gender dynamic, and so which automatically means that we'll be dealing with issues of masculinity, looking at issues of hegemonic masculinity and the cycle that reinforces patriarchy within society. We're going to be looking at issues also that are structural in terms of poor health-seeking behavior that is peculiar to men, also socializing of the boy child. So we're looking at those psychosocial issues because ultimately this program is about social behavioral change. It's the RDP of the mind, really, and at the root of many of the issues that we engage with, it's the challenge of how we perceive masculinity, our understanding of masculinity, our definition of being a man, and that's how we normalize some of the issues around problematic language, gender-rigid stereotypes, objectification of women, and that's the level that we need to change before we graduate to the higher levels of degrading through verbal harassment, verbal abuse, which can, of course, lead to taking away autonomy of people and ultimately explicit violence.
Matome Kganakga, we're going to have to leave it there. Thank you so much indeed. And strength to the movement. And let's hope that it does create change, massive change on these important issues. Thank you so much.
Thank you, Peter. You are the movement. It's not an external. If you're a man, you're already in.
Amen. Thank you.